Title sequence. Image of the Earth rotating. Independent, thriving, self-directed lives for all. International collaboration and Canadian leadership. Webinar recording 29 May 2025.
So welcome everyone. Thank you so much for joining us today. My name is Aisling Blackmore. I'm the International Lead for Disability at the Global Leadership Exchange. I grew up in Boorloo or Perth, Western Australia, on the lands of the Whadjuk Noongar people. And I'm currently joining you from the Sacred Valley in Peru, where there are 14 unique Indigenous communities with living cultures that are going back centuries. I've been lucky to be a visitor to many places where colonisation has occurred, and unfortunately seen how that continues to impact people and communities today. And so seeing the importance of reconciliation to creating societies where everyone can truly thrive. And I was taught that reconciliation begins, but it doesn't end, with recognition and truth-telling. And so in that spirit, I want to open today by acknowledging from coast to coast that Canada sits on the ancestral and unceded territory of the Inuit, Métis and First Nations people who call this land home. And as we make this acknowledgement, recognising that it also comes with a responsibility to improve relationships, build understanding and support self-determination. I also open our webinar by acknowledging leaders with lived and living experience of disability joining the meeting today, because to lead informed by a personal experience is done from a place of strength, and it is often an act of courage. Lived experience leaders are essential to developing our collective understanding of what works and what makes positive difference. And a big welcome and a big thank you to all of you for joining this webinar today. So I'll move now to a short introduction to the organisation, as for many of you, I believe this is your first time joining one of our events. The Global Leadership Exchange is a global network of leaders in disability, mental health and substance use or addictions. And I'll note that because we're an international organisation, some of our language is a little bit different, but we're all working from the best practice language that we have available in our countries or contexts. We exist to help leaders share their knowledge and share what is working well to drive progress towards independent, thriving, self-directed lives for all. And you might have heard of us by our previous name, the International Initiative for Disability Leadership, or IIDL. We use a whole of country membership model. So thanks to our current funding members in Canada, Community Living BC and the Government of Nova Scotia, there is no cost for Canadian disability leaders to register for GLE events online or in person. This is particularly exciting because our signature in-person event, the International Leadership Exchange, will be held in Canada from the 1st to the 5th of June in 2026. And I'll share some more about this at the end of the webinar. GLE brings together leaders from across the disability ecosystem, including lived experience leaders, advocates, family members, government leaders, civil society, service providers, and academia. We believe that leadership is not about a title. Leaders are those who bring people together to work towards a shared purpose, and everyone has the potential to contribute as a leader in their own way. Through GLE, we champion collective and inclusive leadership, and these approaches to tackling the complex challenges that we face together. In the next 2 hours, we're going to explore how connection and collaboration is helping make sure that everyone gets to have a great life. So in the first hour, we have 3 speakers, the Hon Carla Qualtrough, and Bilodeau, and Sean Wiltshire. And they're going to share impacts from participating in GLE international events over a number of years. They're going to discuss how international collaboration has contributed to their leadership journey. And afterwards, attendees will all have a choice of breakout rooms with each speaker for further discussion and Q&A. We'll take a short break because it's important to give everyone some time to refresh. And then in our second hour, we're going to shift focus to one example of crucial work happening in Canada in the disability space. Our keynote speakers, Maria Medioli and Thivjan I'm so sorry, Thivjan Tharmaratnam. I practiced that so many times, I'm so sorry. We'll share the work in progress on the Nova Scotia remedy and how collective and inclusive leadership is shaping the implementation of this important work. And finally, we want you to walk away with a sense of what are we going to do after we've been together for this 2 hours. So Ross Chilton has the responsibility to help us reflect on key takeaways from our webinar. We encourage you to engage with the session and we welcome your feedback through a survey at the end of the event. We aim to create a respectful, inclusive and safe space for dialogue. Some of the accessibility choices we've made to help everyone enjoy this event include enabling automatic captions and automatic translation through Zoom. The chat should be turned off, but you can contact the event organisers if you need help. And please note that the event is being recorded and people may take pictures. So if you would prefer not to have your face recorded, please keep your camera off. But otherwise, we always love to see everyone who's joining us today. So with that, let's move into our very first speaker for the day, which is the Honourable Carla Qualtrough. She's the recently retired Canadian Member of Parliament and Cabinet Minister who held several senior portfolios in government during her 10 years in Parliament, including being Canada's first ever minister responsible for persons with disabilities. She's a successful lawyer, dedicated volunteer and Paralympic swimmer, and a lifelong advocate for disability rights and inclusion.
Well, hi, everyone, and thank you for having me. Oh, my goodness, it's so good to be here. I'm joining you today virtually from Delta, British Columbia, Canada, which is the traditional territory of the Tsawwassen and Musqueam First Nations. After thinking about the various perspectives that I bring to this discussion and wanting really to pay tribute to the work that's being done at GLE, which I will refer to probably more often than not as IIDL. I'm trying to get the GLE language, so I apologize, everyone. I really wanted to speak to you about my experience as a cabinet minister, the first cabinet minister to ever have responsibility for disability in Canada. As you can imagine, as a person with a disability and having previously been a human rights lawyer, I took this responsibility really seriously. And one thing I knew going into this, so this was 2015. The thing I knew was that there really wasn't an established mechanism, system, or process through which disability leaders or stakeholders or organizations could provide input into Canadian government policies, laws, programs, etc. So there wasn't a way for people to be consulted, really, like a formal way. Disability wasn't really considered as a matter of course when decisions were being made by the government of Canada. And really any good work that was being done, which there really was being done because of the people who were in place, not because there was a systemic recognition of the importance of disability inclusion. So that was kind of what we walked into. And I say we because I always thought of it as we as having this opportunity, but also the entire disability community in Canada was given this opportunity as well. There was a void in policy and law, right? Nothing really to ensure that disability was taken into consideration and that people with disabilities would be consulted and have meaningful input into the decisions that were affecting our daily lives, which, by the way, is every decision a government makes. It was really one of the things I must have said thousands of times over the past 10 years, that there really isn't a decision made by a government that doesn't impact or affect the lives of people with disabilities. So we have to be a part of every decision. I also wanted to raise the profile of the good work that was being done by disability organizations in Canada. And I really wanted to reframe the conversation in Canada from one that was more of a reactive approach of accommodation to a proactive approach of disability inclusion. We do have, luckily, and thanks to the hard work of over decades, we have a robust human rights system in Canada. So there is a very, there's a lot going on in the human rights space, but as somebody who practiced in that space, it's very reactive in the sense that you kind of have to wait till somebody is discriminated against before you can help them. So it feels very stifling sometimes to have to wait till that discrimination occurs. So really wanted to back that up and create a more proactive approach. So here's what I wanted to do. I wanted to write law, create policy, change or create government policy, increase profile, to demonstrate Canadian leadership. And I wanted to do it early, and I'm very patient as we're going because I didn't know how I was going to be in the position, and I wanted to make meaningful change. And what I needed to do this was a network. I needed immediate access to experts, people with lived experience, both in Canada and around the world. And what that meant was I needed IIDL or GLE, because this gave us the ability to connect with people from around the world. It provided a way to connect and collaborate globally. You know, as a single point of reference where we could identify and exchange information, Canada could see what was being done in other countries, including what other governments were doing in terms of their strategies and approaches. We could quickly access best practices and disability leaders from around the world. And of course, we could share the good things that we were doing in the world and build upon them. Because IIDL, GLE, was in the business of helping transform systems, and I had a system that I really wanted to transform. So at the ministerial level, at the officials level, and at an individual level, IIDL GLE was incredibly impactful. You know, I had a not so secret weapon, who many of you may know, James Van Royalty, who was with our Government of Canada Office of Disability Issues at the time. And he was actually the vice chair of the sponsoring countries leadership group. What this allowed us to do was really, you know, dig deep and learn quickly and hopefully kind of bring that into our space at a speed that hadn't been done before, because again, I was always mindful of the limited time I may or may not have had in this role. So I actually went to Sydney and was honored to deliver a keynote at the 2017 IIDL Leadership Exchange and participate in the combined network meeting. And this was a fantastic opportunity to meet and learn from other leaders from around the world, people who were thinking big, people who were doing big things and facing big challenges. And as we carried out our work in Canada to develop a legal policy framework for disability inclusion through a collaboration with the disability community, we learned from the work that was being done around the world, work that we knew of because of IIDL GLE. So we had access to experts, people who were willing to share, people who were willing to challenge us, and people who were then willing to share some more. So we participated in many of these events, hosted meetings, and gained a lot from our involvement as a country. And for me, as minister, it was really beneficial to have the structure of IIDL in place, because there was this pre-existing forum where people collaborated, where bridges were being built around the world between governments and civil society. And more personally, it was a place where I could personally get support and lean on other leaders from around the world who had disabilities. And it was an important reminder to me that while I was the only person like me at the cabinet table in Canada, I was not alone in this. There was a lot of other people like me doing the same kinds of things around the world. It made it a little less lonely, because sometimes it felt very alone at that table. Here at home, of course, I was asking the disability community to take a major leap of faith and trust that I would deliver what they said was needed, when, quite frankly, history would suggest that they had absolutely no reason to trust that the government would do this. But together, through collaboration and leadership between 2015 and 2025, we changed the legal and policy landscape for disability inclusion in Canada. From the 2019 Accessible Canada Act to the 2022 Canada Disability Inclusion Action Plan and the 2023 Canada Disability Benefit, we made big things happen together. Super proud. We ratified the Marrakesh Treaty. We acceded to the UNCRPD optional protocol, and so much more. We're just so proud of our history and of our future with GLE. And I'm very proud to have been exposed and introduced to this world. You guys are doing really big things, and there's a lot more work to be done, and we're going to do it together. Thank you.
Thank you so much, Carla. What a really powerful set of reflections to start our time together with. Thank you. Let me introduce everyone now to Anne Bilodeau. Anne's a values-based and proactive and progressive leader who has committed her career to building communities where everyone is valued. She's the CEO of KW Habilitation, a not-for-profit based in Kitchener, Ontario. Anne, take it away.
Thank you. I am actually speaking from Waterloo Region, which is along the Haldimand Tract, which is land promised to the Haudenosaunee people of Six Nations. Wow, I was just listening to Carla and I went, okay, now you're going to listen to me for 5 minutes, and I'm hoping I can be just as inspiring, but a little bit different, because I'm not in the government world necessarily, but I'm more on boots on the ground. It's a real pleasure to be here today and reflect on my journey with Global Leadership Exchange, or I call it GLE. a journey that shaped me in ways that I never imagined, both personally and professionally. It all started in 2018, and I traveled to Surrey, England, and I did the 2-day learning exchange before the World Conference. And I decided to do local area coordination. It was called LAC. I'll be honest, I was excited, I was overwhelmed, I had no idea what I was doing at that time. But what I found in Surrey was something remarkable. It was a model of support that's grounded in relationships, inclusion, and community. LAC isn't just a service model, it's a value-based approach that sees people for their strengths, not just their needs. I met leaders like Sam from England, Eddie from Australia, who are not only passionate about this work, but incredibly generous in sharing their time and insights. From there, we traveled on the Wednesday, then you do the 2-day World Conference to Stockholm, Sweden. And that's where I first heard Clinton, who's not only a disability leader, but he's someone with lived experience, whose voice left a lasting mark on me. It was a turning point. It became clear to me that no matter where you are in the world, the challenges faced by people with disabilities are always the same or very close. In 2019, I joined the GLE exchange again. This time it was in Washington, D.C., and it focused specifically on disability leadership development. The conversations were bold, they were challenging, and they were necessary, exploring what inclusive leadership really looks like. It was there that I met Charlie from Scotland, someone who has since become a dear friend and a thought partner. So you know what a thought partner is, right? You text and you go, what do you think? These weren't just great conversations and inspiring meetings. Every connection I made, from Eddie, Sam, Clinton, Charlie, they all inspired me. And I made a commitment to myself at that time. And that was, I wasn't just going to collect contacts. I was going to bring these relationships and insights back to Ontario and turn them into action if I could. First example was in 2020, COVID hit. And we actually hosted a Zoom conference. Remember those days? Weren't they fun? But what we did was we had a provincial conference and we invited Sam and Clinton to join us via Zoom as our keynote. Their lived and professional experiences brought real depth to the conversation. During COVID, Eddie continued the conversation on LAC, and we would meet with others that we met from all over the world during Zoom all through COVID, so that we knew what was going on in different countries around the LAC. It was fun getting up at 5 o'clock in the morning for those, I might add. Most recently, I returned to Red Hill, England in 2024, where I saw the LAC model still thriving. The stories that were shared by LAC coordinators were deeply human and powerful. It was in Red Hill that I met Tricia from Nova Scotia, who is now helping with the implementation of LAC in New Brunswick and the remedy, and you'll hear more about it shortly. It's working, and it's transforming how communities support people. I'm hopeful that Ontario will take a closer look. From Red Hill, we then traveled to Utrecht. So on the Wednesdays, our travel day, and the last 2 days were in Utrecht. And that's where you listen to different sessions, you share your knowledge. And I listened to Kindness in Leadership that was delivered by Aisling. It had such a, again, profound effect on me that we arranged to have her come last October to Ontario, and she presented at a very large provincial event. Her message was simple but powerful. Kindness isn't soft, it's strong, and it's a leadership tool that we all need. All of this, every exchange, every speaker, every relationship has had a ripple effect. What I've gained through GLE isn't just knowledge, it's action. My leadership has grown not just through what I've done, but through the people I've met. Sam, Charlie, and I, we continue to have tea time every few months to this day. Eddie recently came to Ontario to share the knowledge and work of LAC and the remedy, which inspired everyone that attended this very large conference. Because in the end, leadership isn't about having all the answers. It's about staying connected. It's about being open to growth and taking meaningful action. GLE has shown me that connection is the beginning, right? But what matters is what you do with it. So you plant the seed, but it's watering that's going to make it grow. So if you ever have the chance to be part of Global Leadership Exchange, say yes. Be curious. Let yourself be changed by the people you meet. You'll gain more than perspective. You'll gain purpose, partnership, and a shared belief in what's possible. And if you're like me, you'll meet a few good friends along the way. Thank you.
Thank you, Anne. What a wonderful set of reflections with so much heart. I'm really delighted to have you joining us today. Thank you. So I'd like to introduce everyone now to Sean Wiltshire. He's the CEO of Avalon Employment Inc., which is an employment agency in St. John's, Newfoundland for individuals with disabilities. There he leads an amazing team helping make employment a reality for so many who have the skills to work. Sean has worked around the world supporting businesses and folks in finding their own path to success through employment.
Thanks, Aisling. It's really great to join folks, and it's very difficult to follow up after Anne and Carla. I think that what's important is that a lot of folks in regular community, I often say to folks, I live on a rock in the middle of the North Atlantic, but I knew the Minister of Disability. I knew Anne, I knew Ross. So there's a community in Canada, and I think that we don't always take advantage of that. First, I should acknowledge that I'm from Newfoundland and Labrador, the traditional lands of the Innu, the Inuit, and the Mi'kmaq, and unceded territory 7 generations before, and we look forward to hopefully reconciliation as we move forward. It's one of those things that, for me, has developed deeper communications and connections within my field of working with folks around the world on disability issues. The biggest thing that I found for me personally was I went the very first time to Washington to this global leadership exchange. At the time, it was IIDL and IIML. But I immediately understood that I could have a larger impact. And this was just coming off for me. I had just finished 5 years working in Bangladesh, Nepal, and India, looking for other places to sort of explore what leadership in sort of in a global context meant. And getting to Washington was an opportunity to talk to folks that we had heard about, people who had done research. For some people in the not-for-profit or in the community sector, it's kind of like you get to meet Mick Jagger of your community. You get to have those conversations with folks that are doing innovative things. And all of a sudden, you recognize more so that you are doing innovative things. And that collaboration started. The very quickest story I want to give you is one that we're actually still writing as we move along. In Washington, I had a chance to meet up with Maureen from Canadian Council on Rehabilitation and Work, who I had met at several other things and I knew professionally. But at this event, I had a chance to see outside her world of work. I had to see a chance of what her abilities were in working with other folks in other places. And I thought to myself, I want to work with her. I want to figure out a way to do something. So we connected. And so we connected with some other folks. And over the last number of years, we've gone to a number of events and we've grown not as colleagues, but as also as friends and sharing. That thing that Anne talked about. And when you mentioned Charlie, we all know Charlie. But it gave me the opportunity to work with folks and learn who they were before I developed these partnerships, and they helped me develop these partnerships. So I had opportunity to engage with not only leaderships who are doing innovative things, but as Anne pointed out, just having that conversation of, am I off the wall here by saying this? Is this something that people could get behind? Because the best idea is just the idea that hasn't been shared yet. And having those conversations with other leaders was refreshing and renewing. But it was also something that I had to commit to. And I offer you the same idea that you have to commit to be engaged with GLE, because you can't get the real benefits of the network sitting at home. You have to be engaged. You have to be at these events. You have to put money aside to make sure you're there. You know, the only thing you can change from your couch is the TV channel. So we need to make sure that we're engaged at a level that gives people an opportunity to have their voice. And I've always looked at my role as a leader, not to amplify my own, it's to amplify others. to tell those stories, to share that stage. Our light is never diminished by sharing the light with somebody else. It only makes our light shine brighter. So GLE gave me an opportunity to step onto a global stage, to meet other people. I may live on a rock in the middle of the North Atlantic, but I can have change across my country and around the world. It doesn't matter that we are often limited by what we perceive to be our geographical location or our money. In 9 days' time, I'm going to join 4 other provinces in Nova Scotia to announce a $5 million program in Canada, in Nova Scotia, New Brunswick, Prince Edward Island, and Newfoundland, for folks who are on the autism spectrum. This is something that came from the collaboration that was built out of GLE. It was an idea that came together where 4 provinces, 4 leading groups decided we have a solution. But the solution came from the collaboration and the understanding that we could work together and be independent. So as we go forward on this journey, it's like building a race car while you're driving down the highway at 100 miles an hour. But we work together independently. We respect each other. We understand our roles. GLE helped us with that. And that's the message I want to leave you with. GLE can help you be a better leader and collaborate more along the lines of getting stuff done. You don't always have to be the winner. You can be second and still make change.
Thank you so much, Sean. I love the passion and how active your message has been through your reflections. So thank you so much. So we're moving into our Q&A breakout rooms now. So what's going to happen is I open the breakout rooms and each speaker will go into one, and all of our attendees will have the ability to choose which breakout room you'd like to join. This process can be a little bit messy, so I'm available on the chat to help assign you. If you need any help at all, there's no problem. So I'll open those up now. You have got facilitators in each breakout room, so big thank you to Maureen, Shauna, and Joanna. So they will help you facilitate the Q&A and kick us off with some opening questions. So welcome back, everyone. I'm delighted now to introduce our keynote presentation on sustaining accessible, independent living in the community. We have 2 speakers who will be exploring the Nova Scotia Human Rights Remedy. Maria Medioli is a registered social worker, chartered professional accountant with 25 years of strategic problem-solving experience in the public, not-for-profit and private sectors. She's currently the Executive Director of the Nova Scotia Disability Support Program. And Thivjan Tharmaratnam is dedicated to creating spaces with diverse voices are heard and valued, both in workplaces and in the broader community. His career has included roles across Canada, and he is currently the Executive Director of Inclusion Nova Scotia and Chair of the Disability Rights Coalition of Nova Scotia. And bring Maria and Thivjan to the screen. So over to you, Maria.
Okie doke. Can everybody hear me?
Coming through loud and clear.
Okay, great. Well, thank you for having me. And I apologize in advance. Some of you, like Thivjan, have probably heard my presentation 1,000 times and are bored to tears, but hopefully you'll hear something new. I'm excited to be here to talk to you about the remedy. I guess we're the talk of the town, in both a good way, because we have this remedy which is court ordered, but also in a bad way that it actually took a court order to implement the changes that I'm going to tell you a bit about. I will just go on to the next slide and share my screen. I also want to acknowledge that I'm presenting to you here from Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. All right, can everybody see that? Why is there a remedy? What's actually in the remedy, and how's the implementation going? So we'll start, I'm just going to give you some background on where we were in Nova Scotia before the remedy. There was a lot of fragmentation across the province in our supports for persons with disabilities. And that was because back in 95, 96, we did what was called service exchange, where the municipalities who were delivering social services at the time transferred them to the province. But they essentially transferred 52 separate programs to the province, and the work wasn't done to make them consistent. So there were a lot of differences across the province, and even once the province took over, those programs were regionally administered. So there were significant differences in the experience people would have with service depending on the region where they were. And there were a lot of access challenges to supports. There was an inconsistent interpretation of eligibility, but there were also aspects of eligibility that were discriminatory and that were identified in the human rights complaint, particularly around policy 9.3 and 9.4 that essentially said if an individual's medical or behavioral support needs exceeded what the disability support program provided, you were ineligible. So essentially saying that if you were too disabled, you'd be ineligible for the disability support program. Programs were and continue to be income tested, which were barriers. And there was really what Eddie calls the scarcity mentality. It was like DSP was the oasis in the desert, the only program available. And so everybody was trying to get into DSP as if that was the panacea. We had capped programs, which meant there were limits. And so you essentially had to wait for somebody to leave a program in order to be able to go into it. And that created serious blockages, even in terms of more appropriate cost-effective options. So we had individuals and institutions who couldn't move to less expensive community-based options that were more appropriate because of these program caps and long wait lists. Also, there was a lot of what I call program rigidity. And so our programs were almost like boxes. If you lived at home, you had to be in a certain program called Flex. If you wanted to live independently, and you lived in ILS. But there were policy blocks in each of those. And so often those programs didn't fit the individual needs. And there were many failed attempts at transformation. There was one in 98, the Kendrick report in 2001, the transformation roadmap. So it wasn't like people weren't aware of the challenges. There was just many failed attempts, littered attempts along the way. So in the end, there was a finding of systemic discrimination against the province of Nova Scotia and for a lack of supports for persons with disabilities to live in community. The finding was against the province of Nova Scotia as a whole, not just the disability support program, which I think is a really important element. And the two parties, the Disability Rights Coalition and the Disability Support Program, worked together to create the remedy. We engaged independent reviewers, Eddie Bartnik and Dr. Tim Staten, and they wrote a report, which is available online if you want to see it. And it was basically a 5-year roadmap to remedy the discrimination. The remedy was agreed to by all parties and was ordered by the Human Rights Board of Inquiry on June 28th, 2023. And there's a lot of requirements. We have to report twice a year on progress and the targets, et cetera. And in fact, our second annual progress report is due tomorrow. And so I think that makes a big difference in terms of accountability and transparency. So I want to touch on the 4 grounds of discrimination because they help understand what's in the remedy. These were the issues we're trying to address and were identified by the Human Rights Commission. The first one, which everybody associates with the remedy, is unnecessary institutionalization. So Nova Scotia continues to have purpose-built institutions for persons with disabilities, ranging from what I call the big 7, because there's 7 of them, where the largest is 140, where persons with disabilities are congregated and segregated. We still have group homes, and we also, those are the purpose-built ones. And so under the remedy, we'll have to decrease the occupancy to 4. But we also have other types of institutions where persons with disabilities are living. Nursing homes in particular are an issue. There's 455 people under 65 living in nursing homes. And often individuals are trapped in hospital, forensic units, et cetera. And in fact, the 3 individuals who originally launched the human rights complaint, Joey Delaney, Sheila Livingston, and Beth McLean, had each been in the Nova Scotia hospital, a mental psychiatric hospital, for more than a decade. And that was really, they lodged the original complaint. So those are examples of the types of institutionalization we need to address. The second grounds of discrimination was the right to assistance denied. And so that goes back to that policy I talked about, 9.3 and 9.4, because those individuals really should be eligible. They meet the eligibility criteria for the disability support. We just added a clause that said you're ineligible because we can't support you. So that's an example of assistance being denied to those who are eligible. The other group are individuals who are on our wait list, who are eligible for disability supports but aren't being supported. So we have a large wait list. About 1,100 individuals are on the wait list who are actually in the disability support program but waiting for a different option, but they are being supported. This other group that originally at the time of the complaint, there was about 500 individuals who were receiving nothing. The fourth area of discrimination is denial of community of choice, and that's a really, to me, a central one. Many individuals in Nova Scotia have been forced to leave their community, their home, their family, their support networks to access supports, and they've often had to leave their community because those supports weren't available in their community. So that's a very common story across the province. And then the last grounds of discrimination was delays in assistance. I talked about our wait list with about 17 or 1,800 individuals at the time of the complaint. And it's not just the numbers, it's the length of the wait. I think the average was about 5.8 years for individuals waiting on the wait list to access service, but there are examples of individuals waiting much longer than that. And so that was considered an unacceptable delay in providing requested service. So that's where the remedy came from, but what's actually in the remedy? I like this slide because it really highlights what these 6 key directions I'm going to talk to you about are trying to enable. This is all really the remedy is about, first of all, more choice for participants, more choice for people with disabilities. You know, they have very limited choices, whether they're living in an institutional setting, but often even living in community in terms of how they spend their day, who they live with, etc. So all of the initiatives and changes and program design are really geared towards more choice. They're also intended to be person-directed, to go back to the person with a disability and putting them in charge and giving them the autonomy and the tools to direct their life and make choices about their life. But also investments in community, because a lot of this started from a lack of supports in community. So you'll see there's a, you know, I won't be going too deep, but there are a lot of pieces around increasing capacity of communities to then support people with disabilities to live in their communities. So there's 6 key directions in the remedy, and they really all interact and with each other and leverage each other. So we can't really have one without the other. We have to do all 6. And they're really meant to enable each other. So the first key direction is around support planning and coordination. And we're introducing a new system of individualized planning and support coordination to drive more person-directed planning with a focus on community-based services. So, I mean, that's there's a lot in that statement, but I'll tell you where we're coming from. We're coming from a system where we had what are called care coordinators who did everything from eligibility assessment and funding to support planning to placement to crisis management. And that was not effective for 2 reasons. First of all, they had incredibly high caseloads. I think the average was 83 at the time of the remedy, but some having caseloads as high as 110 and 120. So that's not, you know, conducive to relationship-based supports. That's not conducive to having authentic conversations with individuals about their goals and dreams. That's really just putting out fires. The other issue was that the funding piece was also part of the mandate. So you had somebody doing the funding and the planning. And there's really almost like a conflict of interest there, and the two get conflated. So there's an intentional separation now of those functions. So we have 3 new roles replacing the care coordinator. We have the local area coordinator that I'm sure some of you are familiar with. And, you know, that's a framework of practice rooted in community, supporting persons with disabilities to live in their community and access the natural supports to have a good life like everybody else. And so they will be supporting both people who are eligible for DSP, but also anybody who self-identifies as having a disability. And I think that's a really critical piece. Because as I said before, DSP was a bit of an oasis in the desert and everybody was trying to get in. And really accessing funding and supports or, services isn't necessarily a good life. And so we want to support people to access those natural supports. And the LACs will have a small bit of what we call sparks funding so that they can generate those unique solutions that might make a big difference in somebody's life. Then we have the intense planning and support coordinators, and their caseload will be capped at 20. And they will be supporting those with the most complex needs and those leaving institutions. And again, that's so critical to give them the time and space to really work at the individual level, to imagine what their life could be like in community and to help create that path towards it. And then the final role are what we call eligibility, funding, and assessment coordinators. And that's exactly what their mandate is, to determine eligibility for DSP, determine funding, and conduct assessments. So that's a real quick and dirty on direction number one. There's one other piece in direction number one that I do want to mention, is that we're also developing a peer support planning program. So this would be where individuals with lived experience are supporting other individuals. So that's just in design now. So we want to be able to provide a variety of paths for individuals, back to that choice piece, to access support planning. The second key direction is closing all institutions. That's the one that I think everybody associates with the remedy. But just to be clear, we have to actually close all the big institutions, the ARs, the adult residential centers, regional residential centers, residential care facilities. They need to close, and we need to decrease the occupancy in all other homes to 4. And we also need to include it in the closing institutions, even though we're not closing nursing homes, is providing options to young people living in nursing homes to move into community. We've also implemented a moratorium effective January 1st on all new admissions to the large facilities, the ARCs, RRCs, and RCFs. And then January 2026, there'll be a moratorium on admissions to group homes. The other piece that's unique to us about the remedy is we've actually established regional closure teams. So these are dedicated resources to closing the facilities. In the past, we've closed a couple of facilities, but it was always off the side of somebody's desk. So these are individuals whose full-time job it is to work with the facilities and teams to facilitate closure. And there's another role, a community living facilitator. We have one in each region of the province, and they're actually working in community, identifying and developing local resources to support people as they move back. The third key direction is around community-based supports, and these are new community-based programs to facilitate a home and a life in community. So, if people are moving back, we need to fill the gaps that existed prior to the leaving. And there's a couple of programs that we're introducing there. One is a home share option, which I think some of you I'm sure are familiar with. We actually had a home share program, but it was a little antiquated and maybe paternalistic. The new home share is meant to be much more, I would say, two partners, equal partners, working together to create, to share a home, and really anything, just about anything goes to make that work. And also a school leavers program. And this is a transition planning program where we're going to get into schools, working with young people with disabilities early so they can start to chart out their path for a good life and community. So when it's time to move out of school, they have options besides an adult service center or a sheltered workshop. Multidisciplinary supports are key direction number 4. And so we are going to be establishing multidisciplinary or allied health outreach teams across the province, one in each region. And again, this is because often individuals ended up in institutional settings to access these types of supports. And so we have to make them available in community. And the outreach teams will really have a focus on the unique needs of the people that we support, in terms of not just looking at allied health supports as a one-time intervention, but really about how do those supports facilitate a good life in community. Key direction number 5, which I often say is my favorite key direction, even though it's like saying you have a favorite child, but it is my favorite key direction, just because I think individualized funding can really be the tool to enable choice and autonomy. And so when we say individualized funding, we mean the level of funding an individual receives is unique to their disability-related support needs It's attached to the individual, so it's portable regardless of where they go or how they're supported, and it's self-managed and self-directed. And so right now, about half of our participants are in a form of individualized funding, but not as robust as I've described it. And so over the 5 years, everybody will be shifting to individualized funding, and we'll be introducing what we call an individualized funding administrative backbone. We have a request for proposals for that out right now. And that's a support service to help families and participants administer and manage their money. So we don't expect that all families or participants will want to self-manage all of their funding, but they certainly can self-direct it and determine how it will be used, and they can use this administrative backbone to assist them as they see required. There's also a component in the IF bucket of having IF coaches to support people in developing the skills to self-manage their money, and also peer coaching, again, one-on-one with people with similar lived experience, coaching individuals to self-manage and self-direct. And then the final key direction is really about system capacity. And I often say my tagline is, this is a cultural revolution, not a technical solution. I mean, the technical stuff, tricky, but people have done it elsewhere. When I think of IF, for example, there's lots of examples of IF policies and IF programs. But changing that cultural piece, both in communities, families, my own staff, participants, it's a challenge for people to think differently. It's a challenge for people to conceptualize and peel away all those layers of ableism that got us here in the first place. So there's a whole host of initiatives and requirements under the system change, including an intergovernmental roundtable that has been established and is being chaired by our senior deputy across, the departments of education and health and municipal affairs and housing, et cetera. It includes, an external evaluation as we go. It includes conferences. We've had our second Rebuilding Hope conference on March 29th, which is where everybody comes together and, learns more about the remedy, talks about their experiences so far, and we share information. And if anybody's interested, the whole thing is videoed and available on YouTube. Just Google Rebuilding Hope. And training, there's a whole host of initiatives rolled up, workforce strategy, et cetera, under the system change. I'm going to talk about the regional hubs for a moment, because I think this is really some of the magic sauce for the remedy. Because back to talking about why people had to leave their home communities was to access the types of services that we're going to have available in a regional hub. So we're going to have 4 regional hubs across the province. And it's not an office. It's a collection of services and supports that are, clustered in a region, but delivered locally in community. So as I mentioned, there'll be multidisciplinary and clinical supports through our outreach teams, community capacity building through the regional advisory councils, and our community living facilitators. So we have established on that topic 4 regional advisory councils made up of at least 50% First Voice, whose mandate it is really to identify what the local issues are, to provide solutions and propose options for addressing them. And they'll also have a pot of innovations funding to pilot new and unique solutions. And also part of their mandate is to communicate to their communities about the remedy, what it is, breaking down barriers, bringing people along. So that's the community capacity building piece. The individualized funding will be available regionally through the eligibility funding and assessment coordinators, those regional closure teams I talked about working on the ground closing facilities, and then individualized planning and support. I like this slide. It's back to my favorite key direction, individualized funding, but to give you an idea of where we're headed and what the vision is for the future. In the past, it was a fixed menu of programs, as I mentioned, and they were boxes. And if you didn't fit, then you were in trouble. And so under IF, people will receive their individualized funding and make a plan, and they can choose who they live with. So they can choose to live on their own, with friends and families, with roommates who are also DSP participants, with a community member who's paid to provide support, as in our home share. And there may be options here we haven't even thought of. The purpose of this slide is just to open people's mind to all the possibilities. And so they could choose to live in a home they own, in a home they rent, in a room in somebody else's home, in a home owned by a service provider. And they could choose, as we talked about, all those options to completely self-manage their funding with support. They could self-manage it through the IF backbone, or they could have a service provider manage their IF. And the supports could be supports that come in the home, paid or unpaid. They could be supports in community. They could be supports that live with them. All of these options and more are how we envision the future of IF. So how is the implementation going? Well, today's probably not the best day to ask me, just because I'm still working on that annual report to the court that's due tomorrow. And, you know, in some days it seems like the worst of times, and then other days it's, you know, it's inspiring and exciting. But I think I would say that this is based on feedback from Eddie, who I know is on this call, that according to them, usually these types of system transformations by this point, after 2 years going into year 3, in many other jurisdictions have fizzled. And I would say that we're just gaining momentum. Certainly not perfect, and there's lots of challenges, but I think we're gaining momentum, and I don't think there's any going back. And I think this is for a bunch of reasons. I think it's due to the sustained advocacy of the Disability Rights Coalition, who, you know, many times are the bane of my existence, but it's because of their advocacy that we're here today and we have a remedy. And Thivjan, by the way, is the chair of the board. And so, you know, it's because of their hard work, all those years, 7 years in court, that they fought, and they continue to hold us to account. Government leadership has come. You know, it's been there for us. And in fact, the premier made an apology at our first conference for the discrimination, and there continues to be a significant financial resource commitment. We received 120 additional frontline positions, for example, which is probably a record for provincial government. The collective inclusive leadership, like I said, you know, Thivjan and I are sometimes, as an example, on opposite sides, but we both have the same desired outcome, and we do work together, I'd say, quite well to move forward that agenda. There's defined and ambitious timelines. I mean, it does make a difference when I know that in 6 months I have to go to the court and report against very specific accountabilities, including things like caseload ratios that are established. We have this cross-government approach, and we are working with other government departments, education, health, etc., on different components of the remedy. And like I said, the annual reporting, the targets and the indicators really make a difference. And the whole of population approach, which I love, is that we're not just focused on people in DSP. The idea is to support all persons with disabilities to live a good life in community. And that's what I really like about the remedies. There's pieces to make that happen. So I'm on my last slide because that little clock is there. I think I'm okay for time, but it makes me a bit of a speed talker, so I apologize. But I did want to say that in closing, I do feel like we're rebuilding hope. And rebuilding hope came from First Voice. What were we going to call the conference? And first we said hope, which was homes and opportunities, possibilities, and empowerment. And then we agreed that we're not quite there yet. We're rebuilding the hope. We haven't quite landed on full hope, which I really liked. And here's some photos from our 2 Rebuilding Hope conferences. The one in the top left is me with 2 members of the Mi'kmaq community at our conference that in March, and Mary Agnes to the far right is actually on one of our advisory committees. Below is Tim McDonald holding his artwork. That's the Transformation Butterfly. And he developed the icon for the conference. In the middle is actually our minister, I'll be really quick, meeting with the Disability Rights Coalition. This was just a couple of months ago. And so it was great to have our minister meet with the coalition to start to develop a strong relationship as he's a new minister. And then finally, the shared values, again, which were developed by our First Voice Advisory Committee. And this is a slide of them presenting those values. These are our remedy values. And they were presenting them at the conference. That's it. So thank you.
Yeah, do I just go there, Aisling?
Yeah, please, over to you.
Thanks, Maria. Yeah, so I was just asked to come on to kind of share some perspective about the Disabilities Rights Coalition and how we're moving it forward. I realized I got to stop wearing this shirt because every time we present, Maria puts up that photo and it's the same shirt that I wear. So I'm gonna get a new shirt. So yeah, once again, my name is Thivjan Tharmaratnam. I'm the Executive Director of Inclusion Nova Scotia, which is a provincial not-for-profit organization that advocates for the authentic inclusion of people with disabilities and their families. And I'm the current chair of the Disabilities Rights Coalition. The Disabilities Rights Coalition, at its core, is a cross-sectoral group of people with lived experiences, families, advocates, community organizations working towards to advance the rights of people with disabilities. The coalition actually formed years ago. It grew out of the Kendrick Coalition. As Maria mentioned, there has been many reports and many things done previous to the remedy in Nova Scotia to address some of the gaps in the systems and some of the concerns. And one of the first ones was the Kendrick report. And through the Kendrick report, there was a variety of people who came together to provide consultation. And when it didn't move forward, the Kendrick Coalition was formed to try and really push for that. So I gotta stress, like, we wouldn't be here today without the work of the Kendrick Coalition, which morphed into the Disabilities Rights Coalition over the years to continuously push for the human rights case and then the remedy. And once again, the Kendrick Coalition and the Disabilities Rights Coalition was it was a group of Nova Scotians who believe that people with disabilities needed to live inclusively in community and have their rights heard and recognized. So where it was previously when it was the human rights case and we were, I guess, more adversarial and combative, because at that point the Disabilities Rights Coalition needed to be. It was really around ensuring that the human rights case was pushed through, and we were the legal driving force to make sure that the case went through the courts and got recognized. And so together with the individual complaints. We challenge the systemic discrimination faced by people to have who are forced to live in an institutionalized setting, and really move towards a system where they would be able to live authentic lives in community with the supports that they needed. The case was described at the time as a civil rights case of our generation, and it speaks really to the depth and the structural changes that collective actions can achieve. Now, as we sit here in this moment of the remedy, although we sit in a space where we want to ensure that we are holding Maria and the province accountable, and I want to stress that I think the Disabilities Rights Coalition, and in particular through the work and the conversations that we've been having or had with Eddie and Tim and the Global Leadership Exchange, recognize the need to really push this at the provincial level. So even though we did get the provincial acknowledgement from the Premier, we know a lot of this work is still landing within the disability support system and within the Department of Opportunities and Social Development. And so really now it's about how do we ensure that all the ministries, housing, education, are all coming to the, et cetera, to coming to the table to make sure that the various directives are implemented. So as we hold them accountable, we are also working in a collaborative manner to ensure that this thing moves forward, because we know that going back to the courts and going back to the legal process is just going to delay things. And we also recognize that, like Maria mentioned, this is a huge cultural shift and a huge change within the sector for individuals, for families, and any momentum that is lost through the legal process is just going to deter that and create almost a polarization of, does this need to happen? Should this happen? Because we're already hearing those voices, and we're hearing the fear that comes from the remedy and the transformative changes in stories that are popping up. And it's really around how do we, as Maria said, rebuild hope and hold on to hope and keep pushing forward as a coalition and bringing the positive stories to head and the positive wins, and really pushing to hold the timelines and the directives accountable in a manner that is collaborative and meaningful so that the remedy does get implemented. So the DRC, I mean, we're more than an observer, I guess, in this situation. Really, we're the connection to the people. We are the coalition of individuals, families, service providers who can bring the concerns forward, highlight the gaps, ensure that these directives and changes are made at a systems level, but then also at a level across a province that is equitable. And I think that's one of the key roles that we play. And then I do think that we, as we have moved forward and as we have seen the progress and the successes, it is around, pushing that hope and pushing that pushing people to see the possibilities that can come with the remedy. So inclusive leadership in this context means really making the space for all voices. It's not just making sure that people are heard, but it's about ensuring that we're on the agenda. It means moving at a speed of trust and refusing to leave people behind. The remedy provides us really good opportunity to showcase how advocacy isn't separate from leadership. Advocacy is leadership, and the coalition of people guides the remedy's transformative work. And the remedy builds the resources as a province that supports people to work with people, not on them. And I think that's really the shift that we're seeing within both the disability sector, but then also hopefully we'll make strides in seeing that on the provincial scape as well. So real change happens when community systems and government shift in response to those decisions. And we've seen, as I've been fortunate enough in this role, but then also in my role as Executive Director of Inclusion Nova Scotia, to be able to talk about the remedy both locally to various groups, but then also provincially in Ontario and BC. And people always ask, how do we get the remedy here? And beyond getting a human rights complaint and a human rights process going, which, like I said, took over 20 years to really go from the Kendra Coalition all the way to where we are right now. I think it is that collective advocacy and the building of that collective voice and across the province that allowed us to do that. I mean, Nova Scotia, we're fortunate that we are small in numbers, but I think that ability to bring this to the forefront was huge in doing that. And I gotta give credit to the people like Barb Horner and Marty Wexler who were there from day one and fought through it and were sticking with it all the way to where we are today. So as the coalition has moved towards this monitoring of the remedy, really we're watching, we're pushing Maria and the team as well as partnering to ensure that the full realization of the human rights decision. And as we continue to grow the movement, for the coalition, it's really around how do we connect with people at the local level? How do we get the insights, the stories from folks so that we are able to highlight both the concerns as well as the wins within community around the remedy. And although there's a lot of fear that comes with this transformative change, it's an exciting time for Nova Scotia. And I know that all eyes are on Nova Scotia, and specifically all eyes are on the sector. And as we move away from problem solving and getting people to instead, imagine hope and lead with possibilities, we hope that this can be seen as an example for the possibilities to come across the globe. Look at that, under a minute. I don't know.
A huge thank you to both of you, Maria and Thivjan, for such a comprehensive introduction to the remedy and the work in progress, but also really highlighting that power of collaboration in your systems revolution that you're engaging in the province. We're really grateful for your time. I'd like to introduce now Ross Chilton, who has the challenging job of trying to find some of the key themes that we've been talking about today, and trying to find maybe some some messages for you to take home with you or take forward with you into your day, because we've heard so many great and diverse perspectives. So Ross is well equipped to do this, though, because he's a long-time leader in British Columbia's community living sector, brings extensive experience in advancing inclusion in social service agencies and on boards. He's CEO of Community Living British Columbia, and his organisation is the lead member for the Canadian GLE Disability Membership. Over to you, Ross.
Thank you, Aisling. And I didn't think it was going to be as hard as it's turned out to be, having heard these great 5 speakers talk about amazing things. And one of the things that strikes me is just how the work is so important to everybody on this call. It means so much. This isn't just sort of a thing that you do and then kind of go home and put it away. These are mission-driven people that want to see the lives of people with disabilities improve. And to remember that when we succeed in helping people with developmental disabilities or other disabilities to be central in community, to be part of community, not just in community, but part of it, that's not just good for them, that's good for the community. And that's a, sort of, I think, a lasting message I have is that the work that you're doing will definitely improve those lives that we're targeting, but others as well, particularly other marginalized populations who, again, try to be, fight their way into the center of society. Carla, I just want to thank you because I know during the depths of the pandemic, you formed a group of people from across Canada to look at sort of how the federal government could respond to the pandemic and its impacts on people with disabilities, which ultimately led to the Canadian Disability Benefit. And I know there's complaints that it's not including enough people or it's not enough money, but it's a great starting point. And just really appreciate all the effort that you put into consulting for meaningful impact. And I think that that's, again, a common theme across the group is that it's not just kind of listening, but listening deeply to what's going on for people and what they want. I know that many people have said that, services are not a life. They're not a replacement for a life. And services are to help you have that life. And we all need them, especially as we get older. We need different things, but it's not to think that services are a life. And that the connection that I heard from everybody about being able to connect globally as well as locally. I know I said to Aisling and to Eddie in one of my goals for GLE in Canada was that I would know as much about what's going on across Canada as I do internationally. Because sometimes we see what's going on in different parts of the world. But I'd really like to know what's going on in Canada and how we can collaborate, as Sean said too, to pull together and say what's an area of interest that we all have. How can we advance that collectively? A lot of conversation on trust and trust building and kind of progressing at the speed of trust, which is sort of our particular mantra here at CLPC when it comes to Indigenous people, because we've done a lot to harm the trust and it's ours to re-earn. And we've done a lot to harm the trust of people with disabilities and their families. Again, it's on us to kind of build that trust and to go forward with the conversations, the brave conversations, because none of this is particularly easy. And I really liked how you talked about how this had changed you personally and professionally, and I think that would be true for all of us. This is something it just doesn't change your work, it changes who you are as a person. That the relationships that you will form and sustain and put effort into, like Eddie getting up at 1 o'clock in the morning for this, that effort to kind of connect will reap benefits in ways that you can't imagine. And maybe those benefits are on the hard days or the good days or both. Because we all have those hard days, right? The work is itself hard. I think that kind of staying away from being isolated and realizing that we have people we can reach out to for inspiration or for ideas certainly is something that Global Leadership Exchange offers. Because there is the Canadian community and there's a global community. And I think that, especially at times like now, we realize we need those communities. It's funny because we talk about people with disabilities needing connection, needing community. So do we. And that's pretty evident, right? That we need that as well. And no wonder it's important to people with developmental disabilities. But to collaborate and to kind of have this deep respect for the work that everybody is trying to do to make things just a little bit better. I think Maria and Thivjan, change comes for a number of reasons. And the changes in Nova Scotia came from a hard place. But look what's happening. It's just, it's inspiring to see that. I think Rod commented on this as well, that it kind of goes from one state and it's just a determination for it to be different and to be different in such profound ways. That's you know, I love the idea of the hope around that, is that things can have been a certain way for a very long time. It doesn't mean they need to continue to be that way for a very long time. Things can fundamentally change, and that those challenges of what you presented are challenges for all of us. So say, maybe we've closed the institutions of BC, but we still have struggles around people ending up in long-term care before they should. We still have challenges around people being in the community of choice and living with the people they want to live with. So none of us is better than the other. It's just we all want better, and that kind of unites us. The culture change, I think, is quite interesting because I know when we closed the institutions in BC, the institutions were buildings that were closed, but institutionalized thinking was quite portable and quite powerfully resilient to being challenged. And I think, again, for us to sort of think about what kind of culture change are we trying to create? So the world is a different place. The world is a better place. Not just services are more aligned with what people want, but a better world. And it's ours to make that cultural change, because you can have very institutional care. As Michael Kendrick says, you can disappoint people one at a time, just as you did in large groups. And you can have group homes of 4 that are very institutional, and we struggle with that as well. Just the idea of people having more choice and control in their lives, and who wouldn't want that for them? Because it's sort of, we all have our challenges. When we have choice and control over how we approach those, I think that we're far better off. I like the fact that the Global Leadership Exchange provides spaces for all voices, as was said, that sometimes we need to be pushed, and not pushed over, but pushed ahead. And that's a good thing. The hope and the energy of the presenters, I just want to thank you all, because it's just, I know when I get off the call and get immersed in some of the challenges and struggles of the day-to-day, the week-to-week, month-to-month, to know that there's other people out there who are also working very hard to turn things around, to make them better. It makes that somehow a little bit easier. And so for that, I thank you. Just, Eddie, I don't know if you wanted to throw any reflections. You're much better at this than I am, but I think it was a great couple of hours.
Hey, Ross, that was a pretty fine summary. Just a couple of things that I just sort of picked up. One was people speaking about the values of the relationships, and I think one of your comments was being part of a network and relationships is not just about collecting business cards and names. It's very much about a two-way reciprocal relationship, and I think each of the our first speakers spoke beautifully about the give and take and the depth of the value that's been generated over a long period of time. So this is a relationship-based trusting network, and people will do anything to support you they can. So it's very, very different from a transactional sort of a network. So the second thing was I think there is something here about like mobilizing people across disability and broader coalitions. And when people are stuck in their own lane, then often people are competing with other disability groups, and then really nobody wins. And so there is something here about GLE provides an opportunity for people to get together as a collective. And I think my experience has been that things go a lot further when people get out of their own lane and collaborate with a broader range of groups. I think that's really important as well. And maybe just the last thing, and it sort of surprised me when we first started developing our Australian network, is we would hold country events and people from the same country hadn't even met each other. So there is the international dimension to this, but boy, so many good things happening in Canada, so many incredible people, that I've met. And so part of the value of the network is, in fact, just even the country network of people finding out who else is in the same space and sharing and learning, as well as the international dimension. So there were just a couple of things that I sort of pulled out, but very, very grateful to all the speakers. So thank you very much.
Really, thanks, Eddie, and thanks to the speakers. And I think everybody on this call realizes insight does not equal change. That the people we care about aren't looking for us to just be more insightful about what would be different. They're looking for things to actually be different, and to take those insights that we get from our conversations with each other and have a commitment to bring them into action, as we're hearing in Nova Scotia. It's not just kind of a recognition of the current state of affairs, but a determination to get to a different state of affairs. So I think that's a lovely experience, and really kind of honor all of your work, all of you, in terms of the bringing change to the work every day.
Ross and Eddie, thank you both so much for taking on that challenging job of summarising and giving us some key messages to reflect on. I'm going to invite all of us now to move into some randomly assigned breakout rooms, and this is your chance to talk with your colleagues about what you're taking away, what some of your kind of key messages are going to be as you walk away. I'm going to give 8 minutes, and then automatically the breakout rooms will bring you back, and we'll just have some final thank yous before we finish off the webinar today. As always, I'll be here to help if we need any shifting around, things like that. I'll open those rooms, and I hope you have a great conversation. I have checked the timer as well, so see you in 8 minutes. So thank you so much, everyone. I hope there's been so many rich reflections shared today. So I really hope that each of you are buzzing with ideas and energy. And if you've enjoyed this experience, then I hope you will consider staying in touch with GLE and becoming a member through our website. I think you've had a taste of we've tried to, in these webinars, give you a taste of the cross-section of really interesting information, leadership journeys, and personal connections. So our GLE members get access to a monthly newsletter with curated resources and innovations in the disability space, webinars like these on international and domestic topics. There are topic networks that meet semi-regularly, and there is our International Leadership Exchange event every 2 years. And as I said at the beginning of the webinar, it's coming to Canada, the 1st to the 5th of June 2026 in Ottawa. And the exchange has 2 parts, and you heard about this a little bit, particularly through Anne's reflections. So the first 2 days are what we call a match, and that's a deep dive into a focus topic with a smaller group, and it's hosted across Canada. So we anticipate we'll have some in Nova Scotia and hopefully some in Vancouver. And when I say topics, I mean things like housing or workforce or building self-advocacy, those kinds of things. So meeting with a like-minded group of people from all around your region, but also all around the world, who are all working on the same thing and sharing really great, innovative, interesting work and supporting each other as you heard, supporting each other over time, as you heard from our stories of change. We then have a travel day, because obviously if you're trying to get from Vancouver to Ottawa, that's going to take you a little bit of time. And then the last 2 days are what we call the network meeting, which is broad learning across multiple topics and streams. So we anticipate having 400 plus leaders from around the world in one location. And that's where you get kind of the breadth. So you might get to then debrief a little bit about your match, which was all about disability employment, with people who were talking about housing or social inclusion or supported decision making, and really cross-pollinate a bit more. We've been supported in planning the agenda for this by our GLE Canadian Disability Planning Group, and this group brings together leaders from across Canada, and they also contributed to the planning, the promotion and the delivery of this webinar. So I really want to give a huge thank you to all of the members of the group for their ongoing support and their commitment across these two kind of pieces of work, bringing our Canadian leaders together and also planning a fantastic event and showcasing the great work that's happening in Canada. Big thank you to all of our speakers, Carla, Anne, Sean, Maria, Thivjan and Ross, and to our facilitators, Maureen, Joanna and Shauna. And a huge thank you to all of you who have attended today for your time, your attention and your participation. Simply can't hold these kind of events without you. So as you go forward into your day, I hope there is some kernel from the webinar that you'll take forward with you and that will help keep that spark alive as you engage in your important work. Thank you and goodbye.